Nursing in India. History of nursing in India goes back to about 1500 BC. It was found that diseases were attributed to demons and the treatment given was primarily to exorcise the demons, means to force an evil spirit to leave a person or place through prayers or the invocation of higher powers. About 700 BC, the practice of medicine has passed into the hands of the Brahmins, who were scholars and members of the priestly class. Banaras became the center of medical education. Halls of healing was found. This time, Sushruta brought the practice of surgery to a very high standard. He and Charaka, the famous physicians, were leading authorities on the ancient Indian system known as Ayurveda, the science of life. Sushruta gave detailed instruction for ensuring absolute cleanliness in all departments, described the technique of surgical procedures, defined the relation of doctor, patient, nurse, and medicine as the 4 feet on which cure must rest. Ancient people believed more in prevention than in cure. Doctors were also well trained not only in medicine and surgery but also in prevention of illness. The period 500 BC to 300 AD saw the rise of Buddhism. It is the period when medicine rose to a great height. King Ashoka established a large number of hospitals and health care centers for his people. The practice of surgery declined during this period, but other branches of medicine made great advances, and hospitals were built for the sick, blind, and deformed people. Military nursing. March 25, 1888 is memorable history for troops in India. Troops mean soldiers or armed forces. On this day, 10 qualified certified nurses landed in Bombay and Indian Nursing Service was formed. It later developed into one of the finest military nursing services in the world. The first lady superintendent was Miss Locke. Through the Indian military services was born during the First World War. It slowly developed until Second World War of 1939. 45 nurses were recruited in India for the first time in 1914 and attached to Queen Alexandra. Military nursing services in India was formed in 1927 and it had 12 matrons, 18 sisters, 25 staff nurses. They were responsible for the supervision and training of nursing section in all Indian hospitals. These services continued to grow for many years. Government and municipal hospital gave nursing training to Anglo-Indian and Europeans. It was the mission hospitals which started training of Indians as nurses. Christian girls were mainly attracted towards nursing training as nursing practiced compassion to the sick and needy. Present scenario of nursing in India. Development of nursing in India was progressing. In 1908, TNAI, Trained Nurses Association of India, was established. In 1947, Indian Nursing Council Act was passed on the basis of recommendation of Boer Committee. Degree program for nursing started in Vellore. Various efforts were made by the Government of India by forming a number of committees that helped the nursing development. The long felt need for setting up of a review committee for the nursing profession brought in to sharpen focus with the adoption in National Health Program in 1982. Higher Power Committee was appointed by the Ministry of Health and Family Welfare in 1987 to receive role, function, status, preparation of nursing personnel, nursing services, and other issues related to development of the profession, and to make suitable recommendation. A national convention of nurses was held in August 1988. It was a significant development in the field of nursing. The group made constructive recommendation for consideration of the High Power Committee. It had an opportunity to discuss nursing problems with the President and Prime Minister of India. The Central Council of Health, the highest policy making body for health issues. Recommendations were made on improving training nurses in clinical specialties, improve staffing norms, open more PG courses, strengthen regulatory mechanisms, funds for strengthening nursing service.